Good day, I'm Dr. Evony Lambito Alisa Devesa, and now we will gonna have a very interesting topic, okay? Interesting topic about borderline personality disorder. I know some of you actually familiar with regards to borderline personality disorder, and others actually have experienced being with someone having with borderline personality disorder. So I will discuss later the criterias and also the management of those persons who are actually suffering from what we call personality disorders. Okay, have you experienced some person who are, when they are in a relationship, they actually attract a lot of uh, people to be in a romantic relationship, like their opposite sex. For a female, okay, she can actually attract a lot of males. But then when they enter into a romantic relationship or a serious committed relationship, it is a very roller coaster ride because there are a lot of difficulties with regards to the emotions of that person who is suffering from borderline personality disorder, because such person actually have difficulty controlling her emotions, as well as she also have this difficulty with regards to being independent with her partner, especially if she has those fears of being abandoned. So she usually becomes being possessive with a partner, or she actually self do self harm, especially if she feels that her partner is getting away or is not already committed in a relationship. She always has these fears, and then she if you can be with that person, you have difficulty dealing with her, and you feel that, is there something wrong with me, or is there something wrong with what I do? There are a lot of mixed emotions when you are actually being with a person with borderline personality disorder. So what are the signs and symptoms or the criteria for this borderline personality disorder? So here it is. So borderline personality disorder have many criteria. So for the diagnostic criteria for BPD, a pervasive pattern of instability of interpersonal relationships. So, hindi stable yung relationships nila or yung relasyon nila sa mga kapwa-tao or sa relationship in a romantic relationship, as well as yung self-image nila. Yung emotions nila hindi din stable, okay? They also have difficulty controlling their emotions, kaya impulsive sila. It may begin by early adulthood, present in a variety of contexts as indicated by 5 or more of the following. Okay? Frantic efforts to avoid real or imagined abandonment. Yung always na yung fear nila is maiiwan sila, no? A pattern of unstable and intense interpersonal relationships. Yung sinabi ko na roller coaster ride. Okay? Extremes of idealization and devaluation. Meaning, ikaw yung pinakamabait, ikaw yung pinaka. Tapos, pag hindi na okay yung mga ginagawa mo, yung ikaw nang pinaka-worst. Okay, ganun. Identity disturbance din. Okay? Mark persistent unstable self-image nila. And they are impulsive, no? Wala silang self-control. At least 2 areas, like self-damaging, substance abuse, reckless driving, binge eating. Okay, so these are actually the first 4 criterias for borderline personality disorder. So there are other criterias for this. Okay, so recurrent suicidal behavior, okay? They can actually do threats or self-mutilating behavior, self-harm, affective instability due to marked reactivity of mood, intense episodic dysphoria, irritability, anxiety, yung intense yung emotions nila, and ma-feel mo yun. Chronic feelings of emptiness, no? Yung feeling na empty. Parang yung ganun, yung empty na feeling na parang
walang laman yung life mo, parang empty ka. Inappropriate intense anger or difficulty controlling your anger, and transient severe dissociative symptoms. Paranoid din sila, no? Yun yung always na parang may iniisip na baka ganito, ano mangyari, ganyan.
So now you know that borderline personality disorder is actually being with a person whom you don't really think you're not actually aware of what is really happening, what is really what you must feel, or there are a lot of mixed emotions that you cannot understand anymore. Okay, if you did something wrong, she did something wrong, what is happening, okay? So that's why I will explain further this criteria or the manifestations of those persons with personality disorder. So here it is.
So, borderline personality disorder have affective instability, unstable relationships, sexuality, identity disturbance, rejection sensitivity, impulsivity, okay, self-mutilation, and suicidality, and paranoid ideation and dissociation. I will explain this one by one. Okay, so please listen carefully and pay attention. Okay, for affective instability, they're relatively innocuous minor misunderstandings with another person that can precipitate outpourings of rage, okay? Yung extreme emotions nila. When seized by anger, the borderline patient enters an altered state of consciousness in which reasoning, reality testing, okay, and an awareness of the feelings of other people no longer exist. So, baliwala na yun, okay? These intense, excessive romantic longings for the other person are an expression of a type of emotional hunger. Becomes increasingly demanding and impatient, okay? Do you know someone like this? Insisting that there be some reciprocal demonstration of love, sexual encounter early in the relationship. So, yun, yung kahit meet nyo pa lang, dependent na siya sa'yo. And okay, may unstable interpersonal relationships. Emotional hunger can lead to rapid idealization of the other person soon after the meeting. Yung feeling mo na after yung first nyo na date, akala mo siya na yung first and last, ganun. Inevitable flaws of this projected fabric of perfection leads to a devaluation occurs. Siya yung iniisip mo na siya yung perfect for you, and then all of a sudden siya yung worst or hindi siya bagay for you. No, the other person's fault, okay? Pinoproject yun na. Anger can quickly escalate into physical violence. They can be very violent. And they have impaired delay gratification. Instant, dapat ganun, kuha agad. So, tumultuous interpersonal relationship, hyperdramatic, theatrical quality to his involvement with other people, okay? Yung emotional outbursts are expression of uncontrolled affect. Okay, palagi na nagalit, tapos yung outburst talaga, yung extremes. Initial ideation of another person will often be followed by devaluation and denigration. Okay, intense involvement after a relatively superficial encounter with another person is typical. So, hindi talaga stable yung relationship. Away-bate, palaging nag-aaway. Yung extreme pa talaga yung away na parang akala mo may World War I or World War II. Ganun ka-extreme yung pagiging unstable na relationship nila. Okay? So, sexuality, no? Sexually appealing sila and easily attract partners. Okay? They can attract partners talaga. And they are sexually active and orgasmic as well. The exaggerated sexuality may bind the partner as passionate physical intensity compensates for the emotional storms that punctuate other aspects of the relationship. So, yun. Sexually may attraction, pero yung relationship nyo, hindi talaga siya stable. and you don't actually feel happy about it. Okay, so identity disturbance. So, unstable identity. So, they will think na, I never know who I am from day to day. Often seeks identity based on the response of others. So, affected sila sa criticism ng iba. This unstable sense of self will often extend to sexual and gender issues. Am I gay or am I straight? Others, yung babae, lesbian ba ako? Hindi. There's often overlap of borderline PD and also the dissociative identity disorder. Both usually share a history of recurrent childhood trauma. So, yung mga patient namin usually na may BPD, may mga abuses din. Some have sexual abuse actually. So, yun, may mga identity disturbance talaga sila. And others actually seek refuge by for females na nasa sexually abused, no, they seek refuge by being in a feeling na lesbian sila, lalaki sila. This is also common, no, impulsivity. So, poor impulse control talaga. Yung self-destructive or even life-threatening na ginagawa nila. Unprotected sex, okay, with partners who are barely known, okay, with the idea of STI and pregnancy. Use of drugs and alcohol to feel more real or alive. Motivated by wish to escape the profound inner emptiness. Yung sinabi ko kanina, yung feeling nila empty talaga, yung life nila empty, yung empty talaga. Okay, reckless behavior and tempered by rational thought concerning its consequences. So, ginagawa nila, pag gusto, gagawin. Kahit na hindi na nila actually iniisip yung consequence eh. Ginagawa na lang nila. Kasi yun yung gusto nilang gawin as of that moment, okay? So, meron din silang issue with rejection, sensitivity, no? They fear rejection. Di ba may fear of abandonment sila? And are hypersensitive to any subtle fluctuation in the interviewer's attention. As a therapist yun, their volatile and difficult behavior drives people away from them, confirming their worst fears, okay? Self-fulfilling prophecy yung tawag doon. And plunging them into depression. Response to being alone with fear and confusion, desperate need of other person. So, parang hindi nila kayang mabuhay na sila lang. I mean, they cannot be confident na sila lang. Gusto nilang mag-depend talaga. And ayaw nilang ma-reject yung binibigay nila na emotions, yung affections, and they're very sensitive, no, sa criticism of other people, okay? Self-mutilation and suicidality. Yung feeling nila na because of this more emotional difficulties, no, magagawa nila na na saktan yung self nila to feel the physical pain. So, when confronted with rejection by romantic partner, they actually are inflamed with anger or family. Okay? At family or therapist, no, they actually self-mutilate. Sinasaktan nila yung self nila by medication overdose or actually cutting themselves. Dissociative state in which the borderline patient is watching herself, cutting her skin but does not feel present in her body. Okay? Yung feeling nila, they don't feel pain anymore. Possession of control over her body, no one else knows. Okay? Also of paranoid ideation and dissociation, no? Depersonalization, they have loss of feeling of one's own reality. Own body is unfamiliar, changed, fatter, thinner. Reassure that it is temporary. Okay, derealization, experience of the finding the outside world strange and different. They may actually encounter that, but not all. Okay, so be familiar with this paranoid ideation and dissociation. Okay, na feeling nila yung parang hindi ito yung body nila, okay? They are in a strange world, okay? So, other than that, the lack of recognition from the outside world is a blow to the borderline patient's fragile self-esteem and can readily lead to quasi-delusional thinking. So, a belief that he is being cruelly mistreated defends against an even more painful inner feeling of inadequacy, okay? Misperceptions of cues and misunderstandings
other people's intentions. So, common ito. Okay, yung misperceptions and misunderstanding of people's intentions. Okay, now you know that there are actually people, if you actually know someone, there are actually people who are suffering from this personality disorder, which we call borderline PD. Okay, those who are having borderline personality disorder may be aware or may not be aware of their own conditions, and they have this poor insight about their condition. That's why they have difficulty asking for professional help. But if you know someone and you want to help that person, you can actually convince him or her, because it must be voluntary. Okay, we actually assess the person, and then we do the therapy. Okay, most person with borderline personality disorder may have other mental disorders such as depression or bipolar disorder. So we manage those kind of conditions. And then we also do therapy for those person who have borderline personality disorder. So I hope you have learned from this video, and please comment, share, and subscribe to this channel, okay? Uh, Thank you very much for your valuable time. God bless.